question. How can personalized medicine be delivered not just via genomic analysis, but by also weaving in lifestyle data? So we're starting to look at what we're about to talk about, which is the collective picture. So this next session will address just that question and a lot more. So I'd like to welcome to the stage Jonathan Minko. He is the principal electronic architect at Cambridge Consultants. They are a world-leading technology and product development firm, and they have a wonderful booth downstairs, so please have a chance to go visit them. Thank you.
Sure. Thank you for the introduction. Looking at validating the collective picture, and I must say I'm not the only electronics architect at Cambridge Consultants, although that was a great intro, thank you. So more specifically, how can we use biomarkers? How do they impact healthcare? How can they impact patients' lives? And what does it mean to healthcare networks? It's interesting having a background in medical device design that spans a lot of different areas and categories, from cardiac care to patient monitoring to nuclear medicine. Seen a lot of different devices, and now spending a lot of time in drug delivery and diagnostics. The evolution of device manufacturers going from providing only a device to now providing a service via information collected by that device. So once again, Cambridge Consultants, it's not only digital healthcare, but my colleagues work across a number of fields: consumer, power and energy, industrial, wireless. And it's interesting that a lot of the challenges faced across all these different industries and areas of technology have similarities to some of the challenges faced by digital healthcare and implementing those kinds of solutions. And so I find collaboration and partnering very important to solving a lot of these issues. So it's great to have those guys behind me. So just a little bit of introduction. What do we mean by biomarker? Well, it could be a molecule or a gene, something to indicate a physiological condition, perhaps a disease state. Maybe it's the presence of antibodies in response to the body's reaction to an infection or something of this nature. Ideally, you'd want to monitor it over time, track the progression of the disease, or perhaps the therapy and how it's working. There are some drawbacks to traditional biomarkers. Typically, you have to go into a clinic or someplace where blood can be drawn. That then has to go off to a lab where it's processed, a report is generated, it's brought back. A lot of times it has to be interpreted before it's delivered to the patient, before they know and have a picture of what that means to their health. And these snapshots, you'd like to have them all the time, but the reality is you can't have the patients constantly going in. There's an expense to this. So we end up with snapshots that are good, but they occur at larger intervals, and it'd be great to know what's happening to the patient between those times. And not to have them to go into the office or maybe have them passively. So what can be done? What could help the situation? Well, the evolution of digital biomarkers has some promise in addressing some of those things. With the advent of low-cost consumer technology, we're now able to put wearables on our bodies and detect all sorts of physiological conditions and data of how we're performing. Could be activity, could be sleep, could be all interesting parameters that all have a direct correlation to our health. Once again, there are some challenges with digital biomarkers as well, but I believe it can offer quite a bit in kind of completing the picture. And we'll just define a digital biomarker as something that's personally captured that represents physiological or behavioral data that is by a digital device. So what do we do with all this data when we capture it? We already heard there's tons of data. Can people manage this data? Well, I think if you look at social networks, Facebook and other things, you'll see that a lot of this data is already being uploaded, and some of it can actually be groomed and looked at and correlated to health. And it shows that we have the infrastructure, we have the technology for gathering this data, making some sense of it, and that people want to actively take a part in managing this type of thing. whether it be their reputation or their online presence, but I believe healthcare is also a similar thing. And when we're talking about the devices available in sort of the limited things we can measure right now, the investment is only increasing. Over $200 million last year in wearable biosensing. It's only increasing. And so all of this is going to help to bring more options for collecting data on digital biomarkers that could be used to either validate for other uses or just provide general health information. So the first example of how this could be used, or foresee it being used, improving clinical trials. And there's different things, different ways to talk about improvement. If you have the digital biomarkers, detecting this or recording this longitudinal data, big data streams over time, you get a clear picture in between those check-ins, and this extra information might give you enough to shorten your drug trial, perhaps not include as many people if that's appropriate, and these could offer better data endpoints showing how good your drug, or more information on its effects, which just offers more value. There are some limitations, though. To be used in this fashion, a digital biomarker might have to pass the same type of validation that a traditional biomarker may face. And in some cases, those aren't big hurdles, but in other cases, there are some that may be more major than others. And one of these is sort of the class of the device, or what recorded the data, and how accurate or how much variation there is in that actual data and what you're trying to produce as a result. So with commercial products, they can be very good, very accurate, but how do you actually know they're capturing what they intend to capture? Have they been verified in a way, and with a process like an FDA-style process, to prove that they are in fact accurate and not just seemingly accurate? And once again, the variation in that data could be impacted more by how it's collected or when it's collected, or things out of control of the device. And so you have to think about what you're measuring and how it's used, and how that may impact. So if you happen to align with a small amount of variation in a very robust device that's been through a good verification and validation, then you probably have a good candidate for validating these digital biomarkers for use in clinical trials. But what if you don't have all that? What if something is lacking? Well, there is the possibility to notice outlying events, use that for rare event detection, and to kick off a follow-up diagnostic. There's a lot of value in that in preventing events. Or if you have a lot of this data that doesn't have an exact correlation, but it seems to inform a bigger picture of health, you could possibly weight those lower, and those digital biomarkers could be part of a panel where you might have a primary one that's validated, but all of these other lower weighted digital biomarkers are giving the doctor or the clinician a much better picture of what you're dealing with on a daily basis. And then even for strict commercial products that are low cost, that are primarily meant to be activity monitors, that data can have value as well. Excuse me. So one of those is managing chronic disease. In this case, a little case study on Parkinson's disease. I don't know if many of you are aware of the challenges Parkinson's patients face, but in later stages, it's pretty terrible. And there is a whole cocktail of drugs that are prescribed to a Parkinson's patients to try to offset what they're experiencing and get them back to a normal, productive life. The problem is that getting the amounts correct of all these different drugs and their interactions is quite difficult. And additionally, the body develops resistance and immunities to certain treatments over time, so you constantly have to change. And so doctor's office visits, they can see a lot by when a patient walks in the room. They can see their posture, they can see the color of their skin, their eyes, how they're speaking, how they're breathing. A lot can be inferred that the on-site visit, you can't really substitute the information you get just by seeing a patient. But when you want to actually ask the patient how they're doing, this is not as good a source sometimes, because diseases like Parkinson's can affect cognition. And a lot of times the patient doesn't really know how they're doing, or they may have a false sense at the time. Excuse me. So a lot of times the doctor will ask the personal caregiver or spouse what they think, but a lot of times they have an opinion too. They might not see all of the events that have transpired over the last period, and they may miss something critical that would aid in the treatment. So here's a place where just things like maybe something that's measuring your posture, or something that's constantly logging your activity, or, as we've seen, sleep, are very critical in looking at how patients are reacting to a treatment, what their general health is. This could allow for altering of sort of the drugs or the treatment before you get to a point where you have a very bad outcome or an incident that requires hospitalization. In some cases, digital biomarkers could be better suited for treating the lifestyle or the sort of conditions of the patient, ensuring that they're happy and healthy and productive, more than traditional biomarkers. And so you're, in effect, treating the patient more than just treating the disease. So this is, a lot of compelling, great information on how you can use these digital biomarkers. But, really, what is your path to market? How do you get there if you haven't yet invested? Well, I think it's key to look at it as launching with a minimum viable product. You'll never figure out everything you need to know about this. It's as we heard today, it's very complex. And what you need to do is get out there, understand what relates to the disease state and what you think is a good indicator, and get something out there and start building the data. Eventually, you're going to learn from that data over time. You'll build some brand awareness, you'll get some investment, and you'll be able to go back, look at what you've learned, and perhaps decide, do I need a device that's built to some kind of clinical standard or FDA standard that can then validate these markers, or should I spread out and examine these other areas that could impact and inform the health state? And just to reinforce this, when you start off collecting this data, you're really going to only know what just happened. And after a time, you may be able to use this information for diagnostics. But what we really want to get to with this precision medicine is to nudge behavior. Eventually, to be able to predict when a patient's data, or the information from their data, is showing that they're starting to enter a risk category. And maybe we should intervene and tell them, hey, cut that out. We need to get you back on track to make sure you're going to stay healthy. One of the best ways to reduce costs in healthcare is not to have an incident and not to need healthcare. And that benefits both the patient and healthcare networks as well. And looking at the future, there's a lot of predictions about alternative payment methods and alternative business models. And I think right now it'd be tough for anyone to say exactly where we're headed, and there's multiple factors influencing that. But one thing's for sure, that there's a very positive force behind outcomes-based reimbursement, and the fact that pay for services, pay for drugs, pay for things that actually have a positive impact on the patient, and you can prove that. And digital biomarkers are positioned well to sort of act as an agent for proving that. You can collect the data, you can prove that someone's health or activity or lifestyle is improved. That's all correlated to a positive outcome, and that's something that people are willing to pay for. Once again, you don't have to do all of this on your own. There are so many companies addressing one part of the solution, and so many pieces you can borrow, even from other industries, to partner and come up with a solution. So find out what your key component is, what you need to do, get your minimum viable product, and then if you don't have all the pieces, don't just stop. Look to partner, and this will be a good way to go forward. One, I think, general misconception people have is that, well, the technology is not quite there yet. I've heard about digital biomarkers, but I heard there's a lot of problems with implementing and using them. So I'm going to sit in the sidelines until the technology is there. But actually, this isn't a technology problem. We have all of the hardware, we have the devices, we have the infrastructure to use and sort of capitalize on this technology. What's really difficult right now with the changing landscape is to understand the business model and how you're going to interact and make it work through that. Also, giving value to the patients, making them understand that it's in their best interests to participate and use these markers and want to maintain their use. So that market proposition piece, if you can figure that out, how to get the users engaged, the patients engaged, and the business model, you're going to have a very good path for going forward and coming up with a good solution. So in closing, sort of like a call to action. I think now is the time. If you're kind of sitting on the fences thinking about it, you probably are a little behind, and you should look at, how can I get involved? What's my minimum viable product? Partner if you have to. As you can see, from the different case studies and also looking at how this can be used to help both care networks, device manufacturers or drug makers to prove that their treatments or devices are more effective, that can only benefit the patient in the end because he's receiving treatments, he's receiving drugs that are more effective and are going to help not only treat his conditions but prevent him from getting anything, falling into an illness state in the first place. So thank you very much. That's my presentation.